The Lanterman Coalition is a coalition of statewide organizations and regional organizations representing and advocating for people with intellectual and developmental disabilities. Every year, we as a coalition come together to identify the issues, the priorities, the topics that are really impacting the IDD community in the state of California. And we're going to dive into a session with you guys about the topics and the priorities, and we hope this is informative to you. And we also hope that this will empower you and equip you for what is happening next, right after this session, which is our virtual lobby day, our call to action, where we will lead you through actually contacting our state representatives about the issues we're going to talk about today. I also want to make sure that we have time at the end to answer your questions. I imagine that you may have questions, and this is a group of really intelligent people, myself not included in that, who can answer those questions for you. And so I am thrilled to introduce our members of the Lanterman Coalition and our presenters here today. First and foremost, Tiffany Wyden is Senior Government Advocate at SEIU, California State Council, where she oversees and coordinates state legislative and administrative policy development on many SEIU California policy priorities, including assisted living, IHSS, nursing homes, adult daycare, developmental disabilities, and other long-term care sectors, as well as racial and social justice issues. She not only represents and advocates on behalf of long-term care providers, workers, and consumers, but is also a family caregiver to her mother with Alzheimer's. Whiten's previous roles include working as an associate with Namela Pappas and Associates, a consultant for Senator Mark DeSaulnier, who we heard from earlier in our conference, a legislative aide to Senate Majority Leader Ellen Corbett, and a legislative aide to Senate Pro Tem Don Parada. And we're thrilled to have her with us. Welcome, Tiffany, nice to see you. And also next is Barry Jardini, the Executive Director of the California Disability Services Association, and leads the organization's lobbying and public policy priorities. He cultivates strong relationships with administration officials, legislators, and relevant staff members and colleagues at stakeholder and organization meetings. Barry was named Executive Director in August 2020 after 5 years as CDSA's Director of Government Affairs. He came to CDSA with legislative and management experience, previously served as the in-house counsel to a regional human rights and fair housing commission. A native Southern Californian, Barry has developed a NorCal bona fide as an alumnus of UC Davis and the University Pacific McGeorge School of Law. Hey, Barry, welcome. Thanks for being here. And we're also being joined. Can someone confirm that Rick is on the phone with us? I will introduce him anyway, because I know he'll be joining us at some point. But
I am here.
All right.
I am here, Jordan. Hi.
Thanks, Rick. So Rick Rollens, who is with the Association of Regional Center Agencies. And Rick is joining us by phone today. He has to do that instead of camera, but he'll be with us on phone. He was appointed by California Speaker of the State Assembly to serve on the Blue Ribbon Commission on Autism, also recently appointed by California Superintendent of Public Instruction to the State Department Education's Autism Advisory Committee. And he was involved in the establishment of the UC Davis Mind Institute. Barry, Rick, Tiffany, thanks for hanging out with us for a bit and chatting. I think what would be great is, as we talk about our state policies, we had Peter give us sort of a 101, an overview of the federal landscape. Yesterday we had Scott Graves give us an overview of the state budget, but maybe just a little context of where we are with our state politics, policies. I honestly forget if that was going to be Rick or Barry doing that, but Rick, you I'm sure could do it off the cuff pretty easily. Can you give us maybe just sort of give us some context of where we are in the state of California and the politics that we're looking at right now?
Well, thank you. And thank you, Jordan, for having me. And I'm honored to be on the same panel with two of the most effective and smart and intelligent and competent lobbyists in Sacramento, working so hard for people with developmental disabilities. As a parent of a 30-year-old son with autism and someone who worked in the legislature for 24 years, Secretary of the Senate, I really hope to bring to your conference some insight into some of these issues, both as an advocate, as a parent, and someone who's very familiar with the state capitol and the politics inside that building. We are faced with an interesting situation right now. Every year is different, of course, as we have the challenge of trying to do our very best to support the people that we serve. We're coming off a year, of course, that we all want to forget, but had a huge impact in 2020 on our system and on all of our lives, regardless of where we fit into our system. The budget this year clearly is a tale of two cities. We have good news and some bad news. And you know, the budget really drives, as we know, our funding for our system, and the people behind those decisions are the key policy makers and fiscal decision makers that we have to deal with. The good news is that, as you heard with the previous speaker, you know, money is flowing into California, both on the federal side and on the state side. All the projections are that there's a huge surplus this year going into this year's budget. And very surprising to most of us, I think that we're in this kind of situation, not so much about the federal dollars coming in, but really about how well the state is doing after going through the pandemic and the impact on our system. The good news is there's a lot of money coming in. The bad news is that there's a lot of competition for those dollars. And clearly, as we move forward in our efforts, and Tiffany and Barry will talk in more detail about the priorities of the Lanterman Coalition, we are going to have to really mobilize in a big way to compete for those dollars. The other challenge, of course, that we have this year is that these dollars are being viewed both by the state and by the feds as really one-time appropriation, one-time money. And our system, as we all know, is really based on a system of ongoing funding. It's very difficult, for instance, to hire and maintain staff with our provider community with one-time money, and the same thing is true with supporting the regional centers, particularly with the service coordination shortfall that we have, and so forth with one-time money. So it's incumbent upon us to come up with some good ideas on how that money should be spent. We have a number of changes, as we always do in the legislature this year. We lost three major champions in the Senate due to term limits last year: Senator Bell, Senator Mitchell, and Senator Monning. And a couple major changes that occurred in who we deal with in the policy side and fiscal side, with changes in the chair. We have a brand new chair of the Assembly Human Services Committee, Assemblymember Lisa Calderon, and a new chair in our budget subcommittee in the Senate, Senator Eggman. We, as you know, depend heavily on support and lobbying efforts on the leadership with both Pro Tem Atkins and Speaker Rendon, and we'll be, of course, continue to be doing that work. For all of you, you're coming out of this conference, I'm sure, thinking, what can I do? And clearly, our efforts here are to continue to keep our community front and forward before the legislature and before the administration. There's lots of competition for those dollars. Here in Sacramento, there's a saying, you're either at the table or on the table, and we need to continue to keep our community very active and in the face, quite frankly, of members of the legislature and the administration. And with that, I will turn it back over to you, Jordan, and look forward to hearing from my colleagues on the panel.
Rick, that was a perfect overview of where we are. And you're absolutely right. There's money coming in, but it's short-lived, and lots of people are going to be fighting for that money. And so you mentioned it, that we have to determine our priorities, and we as a community have to fight for it, which is what this rally day is all about. Tiffany and Barry, I know that we have, and you guys have, some ideas for some of those priorities of where money should be invested by the state of California. Tiffany, you want to talk a little bit about some of the priorities for SEIU and ways that you guys have thought of to improve the supports and the system of supports and services for people with IDD?
Yes, thank you so much, Jordan. Good morning, everybody. Tiffany Whiten with SEIU California. We're representing direct support providers and service coordinators at regional centers. We're a proud member of the Lanterman Coalition. And again, I'm just so happy to be here with you guys today. I'm going to dive into a couple of the not only SEIU priorities, but Lanterman Coalition priorities for the year. And then we're going to hand it all over to Barry, who can definitely fill in some additional details. But we wanted to begin by just noting that March marks 1 year of many challenges of the COVID pandemic. So while many of these issues that we're going to discuss are not new, they're certainly heightened with the pandemic. So in 2019, the budget, we received an 8.2% increase to provider rates in various service categories. In 2020, that 8.2% was appropriated, but subject to a suspension date of December 31st, 2021. This year's budget proposes an extension until 2022, but includes language that puts this cut right back on the table in the out years. Rate increases are not a temporary funding solution. They are ongoing in nature and they should be treated as such. So this year we are going to fight to remove that suspension altogether. One of our Lanterman suggested guiding principles for the legislature and the administration when it comes to the system is commit to long-term workforce and system sustainability. Giving and taking away this rate increase definitely does not show commitment to the workforce, nor does it ensure sustainability. So not only are we going to ask the legislature to remove the suspension date, we also want to ask them to reject any types of new proposed funding reductions to the system. The system just cannot handle that and definitely can't handle it during a pandemic. So I just wanted to note that this 8.2% and remind folks that this was just a down payment that was going to address the larger $1.4 billion deficit that was identified in the 2019 rate study. So at the same time that we will fight to keep the rate increases intact, we will also push for the legislature and the administration to focus and not lose sight on of the larger conversation that still needs to be had, which is how do we ultimately address the rate study and the overall deficit to the system. In addition to the 8.2%, we're also going to be prioritizing funding to address the caseload ratios for service coordinators at regional centers. Service coordinators were experiencing high caseloads prior to the pandemic. Now, with the rapidly changing needs and the types of services due to the pandemic, service coordinators are more overworked than ever. The state needs 850 new service coordinators in order to not only meet the needs of the consumers, but to reduce the caseloads to the federal requirements. Our ask specifically is for $55 million to increase the number of service coordinators. We also provide alternative options for investments, so partial funding options. For example, if the state chooses not to appropriate the full $55 million and rather proposes provide, say, 20 million, that would amount to roughly 309 additional service coordinators. We would have to continue to seek future appropriation to completely address all 850, but it would be a step in the right direction and much needed during a pandemic. And as was already noted here earlier today, that there's so much money coming in that we just have to, we can't do anything but stay hopeful that some of that money has to flow to our system so that we can infuse it here. So not only are caseloads high and the needs of consumers have changed, but the service coordinators are also charged with, and totally understandably, but they're charged with assisting in the vaccine rollout as well. So the service coordinators are in need of some relief, which is why we are putting forth this proposal. These are two proposals that, again, they're not new proposals. They are proposals that have definitely been heightened during the time of the pandemic. And so this is why we're going to be pushing for two of these proposals this year. So I will stop there and hand it back to Jordan. Thank you so much.
Thanks, Tiffany, very much for that. And I'm going to pause just for a moment for those individuals who are doing this for continuing education credits to hand it over to Chip for quick interruption.
Yes, sorry to interrupt. This session is being co-sponsored by the Golden State Pooled Trust and is eligible for the minimum continuing legal education credits. The MCLE credit is approved by the State Bar of California and the North Bay Housing Coalition. To receive credit, you must write down the following code, 4478. Again, that is 4478. And you must include that in your form response to amy@gspt.org to receive your credit along with your post-event survey. Thanks so much.
Barry, I saw you writing that code down. Does that count if you're giving the presentation, if you're an attorney? I don't know.
I'm not even kidding, Jordan. Thank you for noticing that. I was like, wait a minute, am I going to get MCLE credits for being here today? I don't think that's how it works. Anyway, what a way to introduce myself, and apologies, but Jordan, thanks. I'm Barry Jardini. I'm the executive director at the California Disability Services Association. We are a statewide trade association representing members who provide services throughout the state of California, providing the full range of services to individuals with IDD. It is a great pleasure to be with you all today. I'm actually quite jealous of all of you who've been able to attend the whole conference. Looks like you guys had such a cool program for the whole thing. So kudos to the full ARC team. And it's a great honor to be on a panel with Tiffany and Rick. As Rick said, I don't want to steal his thunder, but it's a great, I have tremendous respect for both of you, and it's wonderful to be with you here today. So I get to kind of fill in some gaps here. I think Rick gave us a great overview, and Tiffany provided some insights on our key priorities. But, I wanted to just take a little bit of a step even further back. The Lanterman Coalition is a group of 25-ish organizations, regional and statewide, who all band together to do our best to make this system work as well as possible for people with IDD. That's our core overriding goal. I mean, it's reflected in our name. We're the Lanterman Coalition. We are here to protect and preserve the Lanterman Act. So everything we do in determining our policy priorities and how we advocate is really driven by that promise and that unique special thing about California that we have in the Lanterman Act. And so it's not lost on us that is why we're all here and why we're all doing this work. So this year, like for everyone, it's a year like no other. In terms of our policy space and how we can try to make the best impact possible for individuals with IDD. We started this planning process early, but the year has changed considerably from where we started. We came into this thinking we'd be facing budget cuts. Obviously, you've heard that we're not facing budget cuts. In fact, now we're trying to figure out how we can capitalize on some investment opportunities. So, as we looked at this, we had three primary recommendations that kind of guided our policy focus, and that's prioritizing the health and safety of staff and clients during the pandemic. We've seen a tremendous partnership from all levels of the system to ensure that we were getting adequate PPE out. We were making sure people were safe. The policy development was quick and done in collaboration with the department, regional centers, all aspects of the system to make sure that we were doing our best to keep people safe and keep the system afloat. So that was one priority. The other was strengthening individual and family access to critical supports. I think certainly what Tiffany spoke to, making sure that we don't face cuts is absolutely critical to that from a policy perspective. But it's beyond that. I mean, we actually have developed new manners of service delivery through alternative services. And while we know other providers who've continued to deliver traditional services have needed additional supports and additional funding as well. So, there's an opportunity for us, I think, this year to make that a priority, to make sure that some of these flexibilities continue into the future so that we can make sure that we are as person-centered as possible. I know a lot of folks have enjoyed some of the new mechanisms of service delivery, and we want to make sure that that is an option for them going forward. And finally, I think, we spend a lot of our time when we do our lobbying and our advocacy on the direct service professional workforce. And we know that family caregivers and DSPs are the absolute backbone of the system. It does not work without the people who are doing the work. So, we have always tried to center DSPs along with individuals with IDD as kind of our primary focus. And we want to make sure that DSPs are reflected as the professionals that they really are. And one of the ways that we've identified to do that this year is to try to ensure that we can give them wage increases that are commensurate or equal to their professionalism. And so we've got a proposal in our budget requests to modify the rate adjustment mechanism when the state minimum wage goes up. Right now, when state minimum wage goes up, certain providers are able to get increases to pay their staff more, but that's unfortunately not equitable throughout the state. Not all providers are eligible, which means DSPs throughout the state, many of them do not see any increase as the state minimum wage goes up. So we're proposing a plan to provide an automatic rate increase when the state minimum wage goes up to ensure that DSPs throughout the state at multiple levels are going to get a bump to keep them out of being minimum wage workers to the degree possible, and so that they are paid as, you know, as closely to the professionals that they are. I don't think we're anywhere close to really paying DSPs fairly from my perspective, and that's not a criticism of any individual provider agency. It's like it's a reflection of the money that we get in the budget for it. So that is the other main priority that we're pushing this year is really finding a way that we can get those rate increases automatically applied so that DSPs can be paid fairly and for, you know, commensurately to the work that they do.
Thanks, Barry, for outlining that and for the context of the Lanterman Coalition. And to answer a question in the Q&A real fast, we are going to talk about how you can become involved in our advocacy. And actually, right after this session, you will have a chance to be an advocate and advocate on the issues we're talking about right now. Rick, I'll hand it over to you if you want to highlight any of the things Tiffany said or anything else regarding some of the priorities.
No, I'm very proud on a personal level and a professional level, of course, to be involved with the Lanterman Coalition. In representing the Association of Regional Center Agencies, we were one of the founding groups of the Lanterman Coalition way back when, and it's been great to be involved with the Lanterman Coalition in developing these priorities that serve the entire system. And I've got to say, as a parent and as an advocate, the Lanterman Coalition has become a strong and stronger voice every year in the Capitol, as we know and from experience. And when I was on the other side of the ledger inside the building, when you have a community speaking with one voice, it helps tremendously in getting the things that you're advocating for. It's successfully done. United we stand, divided we fall. And it's just great to see the diversity that we have within the Lanterman Coalition, and very proud and honored to be involved with that process. Each of our organizations have individual priorities, as we always will, but we always come together and figure out what the most pressing and most urgent needs are in our system every year. And united, we go across the street to the Capitol. Hopefully this year in person at some point, but in the meantime, virtually, and we'll continue to do the very best in advocating for the people that we serve.
Thanks, Rick. Tiffany, so I'm going to provide a little context and then, ask you a question. Barry provided some history about the recent history about our developmental services system. And as many in this conference may be aware of, there was a rate study that was performed just a couple years ago to determine, we all knew that regional center services were incredibly underfunded. And we found this rate study that we were underfunded by $1.8 billion, an enormous amount. And Tiffany talked about this 8.2%. And we, as a community, many involved in this conference, worked hard to raise our voice and raise the awareness to chip away at that $1.8 billion underfunding. And we were successful in getting about $400 million, which is the 8.2%, but that leaves still $1.4 billion and probably more now. It's been a couple years, costs have gone up, $1.4 billion underfunded. We know that money is available. The budget has been pretty good this year, better than expected. We got a lot of federal money coming in. But for the community as advocates, what do you think people should be feeling right now? How should people be gearing up and be reacting right now? Should they, I don't think people should just be complacent being $1.4 billion underfunded and then regional centers not having the staff they need. What kind of advice and what do you think people should be thinking about right now?
We should be fighting like everybody else. So I think you hit it on the nail earlier. You said everybody is going to be trying to grasp for the money. And I think, and rightfully so, this system should be the loudest ones at the table. It is long overdue for our system to be funded and to be funded appropriately and adequately. And now that we are having this influx of money, albeit one time, and we have to wait in the future years, but that one-time funding can go a very long way in a system that hasn't seen it in so long. And after many cuts and freezes, and this influx of money should definitely have everybody just a little excited. I know that it's uneasy to kind of get so excited when you don't know, how the money is actually going to flow out and who's it going to touch and how much is going to get to everybody. But I do think that it's encouraging, and I think that it's an opportunity for us to be loud, and it's an opportunity for us to be proud and kind of to shout from the rooftop, like, hey, look at us, like our system needs this. And we need to be infused with this funding because it helps some of the states most vulnerable. And that's what we need to do right now, especially in the time of a pandemic. So stay encouraged. I think we stay hopeful, and we shout from the rooftop that we're here and that our system is in dire need of some of that funding.
Awesome. And Barry, what would you give some recommendations for people if they're ready to shout from the rooftops and fight for it? We're going to do a virtual call to action and email in just a bit, but what are some of the things that you would recommend, whether they're individuals with disabilities or providers, staff, regional centers, family members? What are the things that you would suggest people do to get involved and make their voice heard?
Yeah, it's a great question, Jordan, and I really like how you kind of framed these questions, because we are starting from a place of significant underfunding, right? We were 1.8 billion underfunded. We fought really hard as a community to push for that 8.2% to get that first 400 million in. We planned to build on that last year and going forward to create an implementation plan to get to the rest of the 1.4 billion that were underfunded. So now I think as advocates, we can't let them forget this rate study exists. I mean, I know some key legislators know it and they don't forget it, but if we aren't loud about this, to Tiffany's point, if we don't let them know, we started this pandemic 1.4 billion underfunded. We have faced new challenges, new costs. There has been some relief for some of them, but not for all of those additional costs. We need an injection of resources in our system to not only sustain us now, but to really build to a new future. I think the other thing about this pandemic is it's going to transform our system in some ways, right? We're not going to be going back to February 2020. It's not going to look exactly the same. Now, that doesn't mean, anyone's hoping for particular services to go. It's just, we have new opportunities. We've had new experiences. We have to be able to build some of these new models and fold them into what's available to folks with IDD. So that takes money and that takes investment and planning. Sometimes it's things that aren't that exciting, like investing in software infrastructure for the state to maybe make it possible. So I mean, there's ample opportunity, but if I'm telling an advocate today, what am I going to go and talk about? Say, I would highlight the fact that we come into this underfunded, that we have additional costs, and we have significant need for investment. I think centering a lot of that talk around paying DSPs fairly and professional wages is a key component. Most of the dollars in our system for services go directly to DSPs, right? Most of our costs are in wages. We're in the people business. It's people helping people. So, we need that money so that we can continue to grow the DSP pipeline, continue to recruit and retain quality staff so that people get better services. I mean, that at the end of the day, that's what it's all about, making sure those services are as good as possible so that people have the best life experiences and outcomes possible.
Thanks, Barry. And we're going to go to questions in just a minute. So if you do have a question about state policy, budget, policies beyond the budget, put it in the Q&A and we'll get to that. Rick, I'm gonna ask you, and you feel free to add on anything else we've talked about, but also, we're talking about making your voice heard and creating change. And I know you have seen some of that in your day. Can you give us just some history about how voices in our community have come together to create change? What are some of the movements and some of the things that are most memorable to you, the ways that people in this community have made change happen?
Well, that's a great question, Jordan, and thanks for asking it. This system was built, as we all know, on parents who went to the legislature back in the late 1960s and said, hey, we want an alternative to the two choices we have if we have a child with a developmental or intellectual disability. One, keep the child at home with, not even in the case of kids with autism, allowing them to go to public school. That didn't happen until 1972 with then Assemblymember John Burton's bill to allow that to happen. But it was parents that got involved, and particularly mothers from the Bay Area who came to Sacramento and said, we want alternatives to either keeping our children at home with no supports at all, or get on a waiting list to have our child placed in a developmental center. There was no community-based system at that time. Well, they changed the world with the Lanterman Act, and I quite frankly was proud to be working for Congressman Jerry Walde, who was the majority leader at the time in the Assembly when all this happened, and really co-founded, along with Frank Lanterman, that particular the Lanterman Act, which is the basis for our system. Parents got together later and made other major changes. I was proud to be part, quite frankly, of the founding fathers of the Mind Institute that help families with autism. It's the voices at the Capitol that are the real people, is what I sort of refer to them as, the family members and other advocates who are out beating the drums in support of a system that's growing, quite frankly, at an unbelievable rate. Unlike the school system, once you're in the system, you don't age out, you don't change. You're in the system, and we're continuing to add 380,000 individuals and more every day. A budget that continues to increase at almost a rate of $1 billion a year. We have an awesome responsibility to work to try to continue what we have and build on what we have, at the same time not allowing the infrastructure of our system to fall apart, not overburdening and losing the support internally within the regional centers to provide those critical services. And ARCA is a proud co-sponsor, along with SEIU, with the Lanterman Coalition priority of addressing the shortfall of service coordination and service coordinators. We're all in this together, and we all have to continue to advocate and be a loud and strong voice for the people that we serve.
That's amazing, Rick. Thank you for all of that you just shared. We got a few minutes to get to our questions, and we have some really great questions. One is about, it was 7% wages, and I'm assuming that is referring to IHSS, but that kind of also relates to the 8.2% in the developmental services system. Tiffany, do you want to just kind of give an update and talk about where we are with both of those? You already mentioned 8.2.
Yeah, no, happy to. The 7% falls in the same bucket, and that 7% cut is to the IHSS hours of the consumer. So it affects both the consumer and the provider. And so there's 56 organizations all coming together in support of getting rid of the 7% extension and making sure that the 7% also is permanent. Again, it goes back to that influx of money that's going in. How do we capitalize? How do we utilize? How do we take this opportunity? Along with the 8.2% and the 7%, there's about 18 cuts in the human services arena that have all been slated with these suspensions. So how do we take this time and this opportunity to use this money to cover not only the 8.2%, the 7%, but all of those human services cuts that have been made and that are contingent on these suspensions, and cover them so that nobody has to think about it ever again. These are cuts that are being made to a population of the state that the legislature and the administration say that they care a lot about. Well, if they care that much about it, will then put the money up and make sure that we never have to face these cuts again. And so the 7%, the 8.2%, along with all of the other cuts slated in 2022, we are definitely going to have to continue to fight for, but there's a lot of organizations, again, 56 organizations pushing for the 7%, along with so many organizations pushing for the 8.2%. So we just have to, you know, keep our feet to the fire and keep that drumbeat going in order to create this change.
Thanks, Tiffany. And for people to know, if they do have a chance to talk with legislators or get their voice out, Assemblyman Arambulet, who we are going to be with in just a little bit later today, he noted that California made these investments, these increases, and then they said, we'll take them away in a couple years, maybe, but nowhere else other than Human Services did the state of California do that. Why are they giving us money and saying, but we're reserving the right to take it away anytime we want? They don't do that for any other payments or infrastructure developments or contracts or prisons or anything else. They don't say, oh, we'll give you money, but guess what? We're going to put an end date on that money. So why are they doing that with us? That doesn't seem fair. And that's something you guys can bring up in your advocacy efforts out there in the community. Question for Barry. What research is there to support a raise for DSPs, specifically in regards to employee retention, perhaps, or what would a $1 raise do to keep our really great direct support professionals from moving on to better opportunities?
Yeah, thanks, Jay, for letting me answer this when I saw it come into the Q&A, and it's a great question. So thanks for it, BJ. You know, I can't point to specific research around a $1 raise necessarily keeping DSPs, but I think what I'm talking about is bigger picture. The DSP profession in general is overlooked. We don't have a standard occupational classification code for DSPs. So when we did the rate study, for example, they had to put together a lot of different professions to try to define what a DSP does. So I think my bigger point is that, yes, I think basic economics would say if you're paying people more, they're less likely to leave. So that's, I mean, kind of foundational to what I was saying. But also, there's a lot of room for growth in professionalizing the DSP profession. You know, even in the rate study, there was a recommendation to have different tiers of DSPs, 1, 2, and 3, with training and certification. But that only works if you can support a professional career path, and that requires resources. That requires wages that are commensurate to that skill. So when I say advocate for DSPs, I do think that if we're paying them more, there's less likely to be the same amount of turnover. But I also think we could think bigger in terms of some of these federal dollars, this one-time investment, to really invest in a professionalization scheme in California, for example, where we do build a career path that doesn't end up yielding, you know, you hit the max on what you can pay and there's nowhere to go for DSPs. So we lose some great DSPs who've done it for a long time, who don't see a path forward except to go into supervision or management, which is sometimes great, but then sometimes it's just a reflection of that's the only place to go to get more pay. So that's a good question. I hope I spoke to it in some way that makes sense to you.
And Ryan, I will answer your question. The supported living services, there is no proposal to take that away, so no worry about that. Tiffany and Barry and Rick, thanks so much for being with us today and sharing your insights and the priorities for our community as a whole. And somebody asked if there is a way to get in touch with the Lanterman Coalition. In the chat right now is a link to the Lanterman Coalition's website. However, I think a lot of those questions may be answered in what we're about to do now, which is take action together on what Rick, Barry, and Tiffany were just talking about. So guys, thank you so much for joining us. Really, really appreciate you.